everyone, my name's Sabrina Corona and this is my presentation on cystic fibrosis. So what is cystic fibrosis? Also known as CF, it's a genetic disorder formed by the mutation of the CFTR gene that individuals are born with. It affects primarily the lungs and digestive organs through an excess of mucus and digestive fluids that coagulate to become thick and sticky. This coagulation prevents airways and digestive passages from having free flow of air and/or digestive byproducts, which can have a detrimental effect on one's health. About 1 in 3,000 babies are born with it in the United States, and it's usually diagnosable by age 2. One of the main organ systems affected by cystic fibrosis is the respiratory tract. Air goes into the body through the mouth or nose and travels through the trachea, where it is separated into the bronchi, then further down into smaller bronchioles until it reaches the alveoli that allow the perfusion of oxygen from the lungs into the airway. On the right side of the screen, you'll see the pancreas, which has specialized ducts that produce digestive enzymes that allow for the breakdown of food in order to absorb what nutrients it can. Thick and sticky mucus blocks these ducts and causes various digestive problems, such as trouble absorbing fats, proteins, and vitamins A, D, E, and K. CF causes swelling in the airway walls and lines these passages with thick, sticky mucus instead of the normally lubricated surface. This can be detrimental for a patient suffering with CF because it not only constricts airflow, but can harbor bacteria and viruses in this thick mucus. A CT of lungs on the left shows a patient with CF, and on the right is a healthy set of lungs. It shows all the mucus that is building up and all the constricted airflow in the patient on the left with cystic fibrosis. Signs and symptoms of cystic fibrosis include a continuous cough with the production of mucus to try to get all of that extra thick, sticky substance out, wheezing from the constricted airways, recurrent lung infections from the harboring bacteria and microbes in that thick and sticky mucus, sinus swelling, swelling of the nasal passageways, greasy stools, and inability to sustain a healthy weight due to that lack of enzymes and the malabsorption, gastrointestinal blockage that can lead to a severe constipation and in some cases anal prolapse. Treatments for CF include antibiotics, vitamin supplements to help with digestion, bronchodilators such as albuterol, oxygen therapy just to aid in perfusion when those alveoli are covered in mucus and unable to perfuse properly, DNase enzyme therapy, vaccines against the yearly flu and the pneumococcal polysaccharide vaccine, lung transplant, and of course, what we're all aware of now is social distancing to minimize the risk of attaining airborne infection altogether. Another really interesting product that is used to help patients with CF is this image called a vibrating vest. It is connected to an air pulse generator that rapidly pumps and unpumps air into and out of the vest, and this causes the vest to put pressure on the chest wall that forces air through the lungs in small, quick bursts that help dislodge the sticky mucus from the airway. According to the Cystic Fibrosis Foundation, the average life expectancy for a patient with cystic fibrosis in 2019 is approximately 32 years. However, with advancements in treatments, babies born with cystic fibrosis in the year 2019 and onward are calculated to live an average lifespan of 46 years. That's a 44% increase from the current generation of CF patients. So, what is an example of advancements in treatment? In 2019, the FDA approved this drug called Trikafta, which is approved for CF patients who are ages 12 and up. It is aimed at increasing the vitality of up to 90% of the existing CF population. According to the FDA, this therapy has proven to be effective at promoting long-term increases in lung capacity and in BMI in patients suffering from worsening health conditions due to the cystic fibrosis disease. Although this is just one of many advancements needed to improve both the quality and quantity of life for patients suffering with cystic fibrosis, it's a small win that can hopefully be the forefront for many more advancements to come for this life-altering disease. Here are my works cited and my images. Thank you so much for watching.